Hello and welcome to my presentation today, which is substantiating claims for CBD and cannabis-derived products. So I work for Ayton Global Research, and we're a consumer research company, and our main service that we provide is consumer research to get evidence to substantiate advertising claims. So of course for me, my real speciality lies in, so what claims can you substantiate and how can you do it? So we often hear about in the CBD industry a lot that you can't make claims, but this isn't necessarily true. You can't make claims on CBD currently, especially in Europe. That's something that we can't do, but every product can have claims on it. Every product can be tested and assessed, and there are claims to be made from it. So I'm going to talk today about what those kinds of products are, how you can distinguish what kinds of claims you're allowed to make about those kinds of products, some examples of people that are using their advertising claims on their CBD products, and some case studies. So let's go through the agenda properly. So yeah, we'll look at global regulations for advertising. So how are adverts regulated? What are the different CBD categories? What's consumer research? I know I've mentioned consumer research. What kind of marketing claims we can make? How do you choose the appropriate study design and methodology? And I'll go through a case study to show you that. And some non-compliant claims for CBD products as well. So just to introduce myself, I am the Regulatory Director at Ayton Global Research. So I've worked there for about 8 years now. I started out as a study manager. So we assign all of our clients with their own study manager because we get to know all of the testing needs for that client, or their research objectives, what their procedures are like and how they need to work, and get to know them really well so we can provide the best evidence for them for however they need to use that evidence. So I've kind of worked my way through different routes in the company, and have found myself into the regulatory field because it's something I'm quite passionate about, and I think it's something that has often been overseen when it comes to advertising and product claims, and I think it's coming to the real forefront now. So my idea is to really push out the education like I am today, and make sure people know about claims, how you regulate them and how you make them as well. So hopefully I've got to provide you with some insight today. So the first thing, just to kind of give the overview of what today's all about, advertising claims. How are ads regulated? So advertising self-regulation is the way that advertisements are generally regulated worldwide. So generally you've got self-regulatory organizations. So basically, as self-explanatory as it is a way for the industry to regulate itself. So instead of there being sort of federal organizations generally, the industry have put out code of conduct, the advertising authorities, and then it's up to the industry to understand that code of conduct and make sure that they're producing proper ads. It's not the case in every single country, and certainly in America, you've got the FTC. In the UAE, you've also got a federal agency that actually deal with advertising as well. So it's not an assumption that it's every single country, but most countries worldwide are doing it in a self-regulation way. So basically, we want to make sure that advertisements are legal, decent, honest, and truthful. That's kind of the overview. Making sure that we're not misleading our consumers, but also making sure that we're not being unfair on our competition. It's kind of the overall for it. There's three parts of the industry. There's the advertisers who are paying for the advertising, the advertising agencies responsible for its form and content, and the media that carry it. So obviously, generally, if we're looking, a lot of you will be from brands and things like that. So obviously you'll kind of fit within that, making the form and content and paying for the advertising. But it can vary to sort of different degrees. The important thing to note, if you fall into any of those categories, you need to be aware of the advertising code of conduct in the countries in which you're operating and which you're advertising, because you are still responsible as well. You'll still fall under the kind of category of what the advertising authority is going to be looking for and who they're going to be looking to. So it works on a complaints basis, basically. So like I said, they're not policing adverts. They're not going out there checking every single label and checking every single thing online and making sure the claims are substantiated, but they are working on a complaints basis. So if you have a competitor or a consumer complain about your product, the advertising authority in the country that complaint's been made will come to you and ask for your evidence for your claim substantiation. It also does work for things like offensive advertising and stuff like that, but for the purposes of today, we'll keep it strictly to claim substantiation. So it's really important to note, because like I said, it might be a consumer that purchased your product, has seen the claims. We often see it for things like hair growth products. That's been quite a big one recently. And they go, my hair hasn't grown at all, so I'm going to complain to my advertising authority, and that they'll approach you for your evidence. It's the same with your competitor. If you've got a claim, and this is going to be particular with CBD, because we, as I said, a lot of us feel like we can't make any claims about CBD whatsoever, or CBD products. You might find that competitors are going to say, well, you've said this about your CBD. I don't think they can say that, because we're not allowed to say it, and they'll complain about your product as well. So it's an important thing to know about, because again, I had a CBD client who sort of told me, I can see all these people that are making these claims and they shouldn't be able to make these claims. And I said, well, if they're your competitor and you don't think they can, you are allowed to make a complaint about it. So it's important to see it as your friend and not your foe when it comes to advertising organizations. Just to keep it really simple today, because I know I haven't got as much time as I usually do for these kinds of presentations, I just want to point your direction to kind of 2 different websites to start looking at advertising self-regulation if you haven't already. So there's the ICC, which is the International Chamber of Commerce. Now, they've got a regulatory framework which countries can adopt to regulate ads in their own territories. So that's a really good place to start looking if you're not really sure, because you can see what that framework is. And I think there's 52 countries now that use that framework. So it gives you an overall picture of what the main countries are sort of doing with advertising self-regulation. There's also ICAS, which is the International Council of Ad Self-Regulation. So that was set up by the European Advertising Regulation, which is the European Advertising Standards Alliance. And it's actually a global organization now. So it's a council of all different advertising regulatory bodies coming together, sharing the same kind of values and code of conduct. And they also put news out on there. So it's really helpful to have a look at. But generally, every country can be, similar or different. So whatever country you're advertising in, those are the advertising SROs that you want to be looking for. So you can use those as tools to start having a look, see what the members are for the ICC and for ICAS, but you'll need to have a look specifically. You also need to be aware of global advertising laws. So there are some countries that don't have advertising SROs, self-regulatory organizations, but that have laws. But actually, all countries have advertising laws anyway. So even if you're not upsetting SRO's code of conduct, you could be upsetting the law, and obviously don't have illegal adverts out there. So just a couple of examples to give you an idea of what those are. In the UAE, you've got the National Media Council. So they've got their own SRO, which is called the Advertising Business Group, but they also have the National Media Council, who've got the right to enforce penalties. So those organizations work together. You've also got the FDA in America, who make laws to protect the public and consumers, including anything to do with sort of advertising as well. And in China, you've got the advertising law of the People's Republic of China, and that's been strengthened in 2015, it's been revised. So it's got tougher rules on advertisers as well. So it's just kind of picking up some examples for you, so you can start having a look at these kinds of laws that are out there. But so let's kind of generalize it back to, specify it back to CBD. So the main thing with CBD, so I'm going to talk about the UK, what they've said about advertising CBD. Because it gives you an example. Also, kind of Europe and UK have a really similar kind of shared view on advertising as well, but also most countries kind of go off the same thing. So yeah, specifically in the UK, you've got the CAP, which is the Copy Advice Team for the Advertising Standards Authority. And what they say about CBD is you just need to know what the product category is. Once you know what the product category is, you can use the guidance on what claims you can make based on that product category. So main categories we're going to go over is for medicine. So in the UK, you need to look at the MHRA for guidance on medicinal CBD. In the USA, it all comes under the Federal Trade Commission Act, that medicinal claims must be substantiated. So obviously making sure you've got those claims substantiated for your medicinal claims. And in Australia, the claims are reviewed when registering with the ARTG. So that's the Australian Therapeutic Goods Regulation. I can't remember what it stands for, but it's to do with therapeutic goods. So that's quite that's the main organisation in Australia. So again, just picking out some countries for you in case you've kind of got a global outlook. For food in the EU, CBD products are classified as foods must go through a novel foods application. So that's something to think about particularly. I'm sure it's being discussed a lot during this conference. So please look into that. In the USA, it can vary from state to state depending on the legal status of cannabis. So again, like I said, you can even think about things country by country, but certainly in the USA, it's even state by state. So it's quite specific there. I want to talk about cosmetic a lot today because that's where we'll see the most advertising claims. And also I'll just touch on borderline products. So for cosmetics, basically CBD is allowed in cosmetics, but the regulations vary on the level and quality of CBD globally. So for example, in the UK, you're allowed 1 milligram of THC in a cosmetic product, regardless of the size of the product. So it's quite vague at the moment. I think things will change there. All claims on cosmetics must be in compliance with regulations with the Advertising Authority Code of Conduct. So whatever the ASA, for example, is saying about cosmetic claims, it must fit in with that. A borderline product is something your product may fit into, especially with something like a CBD, where you kind of get those borderline claims. Is it cosmetic? Is it medicine? But it's all basically worked out if it's a borderline, depending on the substance or mixture, the site of application, so where you're putting it, the function, what's it supposed to do, the composition, and the overall presentation and claims. So you may want to seek advice if you're not sure as well. So basically, I want to just outline the common criteria for cosmetic claims. So the EU Cosmetics Products Regulation has 6 common criteria. And to kind of give you an overview of what those are. So like I said, I'm focusing a lot on cosmetics, but a lot of these apply to every industry. So don't switch off if you're part of a different industry. It's just that cosmetics is where I see the most claims day to day. So it's a really good thing for me to generalize. But yeah, so for the 6 common criteria for cosmetic claims, legal compliance. So you can't have a claim on a product that just states that it's legally compliant, essentially. So if it's a cosmetic, you can't say that it complies with the EU cosmetic regulation. Every product has to do that. So it wouldn't be fair to say that, because it can make it look like your product is able to comply with regulatory and other products can't. You need to be truthful. This we have seen a lot in the CBD industry, I think, where people have been called out for not having the level of CBD they claim on their product, or not even any CBD in their product is the worst culprits. So that's where the truthfulness of your claim comes from. You can't state something that simply isn't true about your product. You must have evidential support. There is no claim that you can't have evidential support for. That is simply the rule. So we'll go through what those kinds of evidence are that you need to have, but you must have evidential support behind your claims. You need to be honest. So if we're looking at claims, if we're looking at consumer claims, you might have something along the lines of 80% of 100 women agree that this product was very nourishing. You can sort of say, well, if 100 people are going to say it, I think 200 would also say it. So I'm going to put 80% of 200 women because it looks better. It's not honest. You have to be completely honest with what you're quoting in your data. It needs to be fair. You can't say that, say you're looking at a pillow spray and one had CBD in it and one was just a lavender spray. And then you said, the people with the CBD spray felt like that, this was the best pillow spray that we tested. Well, there might be a difference between the actual effects of those products. So you'd have to test it against another CBD spray. So that's kind of an example there. I mean, you can say it works better than a lavender product, but you couldn't say it's the best CBD spray if it wasn't tested against a CBD spray. And your consumers need to be able to make an informed decision about the product they're going to buy. So really, as long as you've got all of that in place, I believe they can make an informed decision, but also keep your claims really clear, keep them straightforward. We see it a lot at the moment with like clean beauty claims. That's not very informative, because there's a lot of difference on what clean beauty actually means to a consumer. So it doesn't allow them really to make an informed decision there. Just to kind of a summary as well, the types of claims there are, and different ways of substantiating them. So sensory and product aesthetic claims are to do with the look and feel of the product, the fragrance, the packaging, that kind of thing. Performance claims does the product do what you want it to do? If it's anti-wrinkle, does it diminish wrinkles? Ingredient claims, a very broad example for today would be CBD. It has CBD in it. Combination claims, we see this a lot with things like hair care. So it might be that this conditioner works best when used with this shampoo. You need to have the products tested together to be able to make that claim. A comparison claim, again, very common with competitors, but also really common when you see things like new and improved formula. That's a comparison claim, but it has to have been tested against that product to make that comparison. Subjective claims, which is what we do, consumer research. So it's anything that a consumer can perceive. It's what they feel. It's their opinions. It's a subjective claim. You can't measure it. And then objective claims, which is clinical research. So not something that we conduct ourselves, but something that we do have partners that can do. And it's all about objective. So, it's scientific. There's an instrumental measurement. There's no opinion on it. It simply is science and it's a measurement. So I've talked a little bit about consumer research, but before we go into the case studies and things like that, so I want to give you an overview of what it actually is. So as I mentioned, it's subjective claims. So that in-use test is the consumer's perception of the product itself. So it doesn't mean that you can't make claims, that aren't just opinion-based. You can have things like, it made my skin feel nourished, but you wouldn't have something like 20% higher skin nourishment, because that would be a objective claim. It'd be a measurement. They're usually in-home studies, which are great because it reflects the actual conditions of the products in use. So this is really kind of real data that you get, sometimes arguably more valid than clinical data, because the volunteers aren't, having the moisturize whatever applied on their face for them and have it measured. They're applying it every day, exactly as they would if they picked it up in the store and took it home. So it's really good for getting the actual conditions and use kind of feedback there. They might be assessing the product on its own, or it might be a comparison, and sometimes you may need additional evidence depending on the claim, but we can always advise with that. So as well as substantiating your advertising claims, kind of brief overview of what else you might want to use it for, testing your product efficacy before you even get to that stage. So if you're developing a new CBD moisturizer and you want to just confirm that it is moisturizing the skin, you might want to do a little efficacy test. You want to make sure that it's regulatory and legally compliant in your chosen markets. So as I mentioned, that every country has their own, complaints basis for claims. Now, my biggest example of this is always a long-lasting foundation. So if we were testing a foundation for a global brand, and they just did their consumer study in the UK, and they said, oh yeah, this foundation is really long lasting. They go, great, we've got long lasting as a claim. We're going to put it out in our global market, and they sold it in somewhere like Malaysia. And now the humidity in Malaysia is very different. The climate, the skin types are very different. So someone who's tested it with dry skin in a very cool climate in the UK may not have the same opinion now as someone who's got more oily skin and is testing it in a hot climate. So they might complain about the product, and we'll find that actually that consumer research evidence wasn't enough to substantiate that claim. So you don't have to test in every single market that you're selling, but it's really good to pick key territories and kind of a representation of those markets. You also can target your key demographic and assess your product acceptability within those target groups. So instead of just sort of testing it with anyone, you can say, I really think this product's best for women between the age of 30 and 45 that have a nationally representative ethnicity split on our study. That's what we're looking for there. And if you're launching into a new country, you can just find out things like the propensity to buy and the product acceptability, because it might be different to the markets that you're currently testing in. So here's a few claims that we've got for consumer research, or that you typically see from consumer research. Things like 88% of people agree they felt more rested. 9 out of 10 people would recommend this to a friend. 96% of people agree that this product left their skin feeling intensely nourished. So more examples of claims. Now, like I said, this is what consumer research is, but where do we actually see these claims? Where can you use them? Now, the truth is you can use consumer research evidence for any of your claims in any platform, whether it's online, social media, product labels, TV, wherever. As long as you've got that evidence, you can use that wherever. But I think examples are always really good to sort of see how it is used successfully. So I've got some examples here from The Body Shop, from Milk Makeup, and from Kiehl's. So The Body Shop have got some clinical evidence there, and then Milk and Kiehl's have got some consumer study evidence. So you can see how they've quoted that on their website. It's really attractive to consumers. They can see every little claim there, and how many people have agreed with it. Sort of 80s, 90s, 100% in there, which is fantastic. It really will help drive your sales. So it's not just about that legal compliance. It's about marketing your product. Use this evidence to really market your product. Again, in social media. So I've got things here. So I've got from Ambience's Instagram and from Kiehl's Facebook page. So, you've got things like soothes, calms, and smells refreshing. That all needs to be substantiated, but then it can be really used to put in your advertising. And on kills, you've got things like, what have they said? So it helps reduce the feeling of stressed skin while helping balance of the hydration. Lovely claims and wording. It hasn't got to be a percentage agree. As long as you've got that evidence, you can sort of word it in this like a nice way that's really relatable to consumers. I also want to just mention that it's really important to note that it's not just about the products you're putting, the advertising you're putting out on your website and things like that. Any kind of claim you have on your product labels is also monitored by the code of the advertising authorities as well. So I just kind of wanted to bring that up and let you know, it's not just about kind of specific percentage claims you put out there. If your product says hydrating or nourishing, it absolutely needs to be substantiated. So I just want to quickly run through a case study that I conducted for a contract manufacturer. So this is for a CBD facial oil. So it's one of the leading personal care contract manufacturers in Europe on behalf of their client. So generally, we work with clients, we work with brands, we work with high street stores, we work with contract manufacturers. We can work with anyone basically, as long as you've got claims to substantiate. So basically, they wanted to substantiate these claims for the clients. So the kind of claims we're talking about when we're saying about CBD, now we can't say what the CBD does, but we can get the product can be assessed, and we can say things like healthier, calmer, nourished, which are generally kind of claims that we relate to CBD basically. So generally claims are derived from the product ingredients and what we're expecting that to be able to do, and then we can make the claims for the product based on that. So they also want to say that improved skin dryness in 4 weeks of use. So it's a lovely claim there, and I'll go through that as well. So being specific about the legislation, this is a European contract manufacturer. I kind of said who's regulating ads, and I've talked about that code of conduct, but I want to lift out something from the EASA's code of conduct exactly. Basically what they're saying is that everybody needs to have evidence to substantiate their claims, and it needs to be presented without delay if you get a complaint about your product. So nothing like to drive home a lot, because a lot of people kind of put a bit of risk out there and say, I'm going to put my claims out there, I'm going to put my product out there, and hopefully I get complained about and I'll be absolutely fine. The problem is if it gets complained about and you can't produce the evidence, it can really vary. So it can go from, just being asked to have your advert taken down. But if you don't respond to that, then trading standards will get involved. And it can be a very costly sort of situation to be in. But back to this case study, the study protocol for this, so this is how we designed the study. It's an in-home user test, single placement because it's just one product being tested it in the UK because that was the target market. It's 28 days because we want to get that 4-week claim, so we need to make sure we run it for at least 4 weeks. They just wanted females on it that were 18 to 45 years old because that's their target market for this product. They needed normal and dry skin types. They had to replace their current moisturizer with the product because obviously this is a hydrating oil. And we had to make sure we recruited nationally. So we didn't just sort of recruit people in London. We wanted to make sure the whole of the UK was invited and recruited because obviously that's the kind of people that are going to be purchasing the product. So what were the results? So basically I've lifted this from our report. We get a sort of summary table at the end of every single report. And we basically have our questions on the left-hand side, which are essentially our claims, are our questions, the number of people that are satisfied and not satisfied, and then the percentage of people that are satisfied and not satisfied. Now, what we're really looking for is the percentage of people, because that's what we're lifting out of those claims. So I sort of showed them earlier. That's exactly how we see it. So we've got things like 98% of people felt their skin was hydrated after use. 96% of people had their skin left feeling nourished. 88% said their skin felt calmer. 88% said their skin felt healthier. And 94% said it prevented dryness and left their skin fully moisturized after 4 weeks of use. That lovely key claim we really needed to get. As you can see, they're all really high percentage claims. So these are going to be not only protecting them with their evidence they need, but they're really fantastic for them to use in their marketing as well. Just a couple of examples to finish up with. This is what happens when you don't get your claims substantiated, or if you don't listen and just do the claims that you want to do anyway. So as we know, the FDA have been really cracking down in the USA about false claims in medicinal cannabis. It ranges from people saying, things like it can cure cancer, stop seizures, which obviously there's just not the substantiation to say. but and down to people sort of saying that they have got CBD in them when they absolutely don't. So the main thing is just to show, if you don't have claim substantiation, these are all news articles. It's bad press. And we see it a lot in the cosmetics industry, where there's a lot of claims that get made without claims, without evidence behind them. And you don't want to have your brand sort of splashed across newspapers to say they didn't have claim substantiation, they said this. So that's just my kind of drive home with it, to say make sure your claims are substantiated, because you don't want that bad press. Another little point as well is just product reviews is something that we have seen a lot of in terms of not getting any claim substantiation, or not even making any claims about the product, and relying on product reviews. But you must have claim substantiation even if you've got product reviews on there. And that's just from the Advertising Standards Authority as well. So they don't constitute a substantiation. So you can't use your product reviews and say, this person said this was the best CBD product that they'd used, their skin felt completely healthy after use. If you haven't got any claims about it, you can't start using those product reviews. If you've got that substantiation about it, you have to get the substantiation as well. Just to summarize, to kind of finish up with why you should use us as a consumer research provider. I've told you why you should use consumer research and claim substantiation, but why you should use us in particular. So we're an award-winning research agency. We're GDPR compliant, and we've got an ISO 27001 to prove that. We've got ISO 9001 as well for our quality assurance. We're a partner to the MRS, which is the Market Research Society. So we get full training with the Market Research Society for proper conducted research, as well as ethical research. We've got things like undesirable event reporting for our Cosmetic Vigilance Act. So if anybody gets a bad reaction to the product, we're completely covered with insurance, and we can also make sure we deal with it properly. Yeah, specific regulatory advice, which is what I provide. So if you've got any regulatory questions about claims or anything like that after this, please feel free to reach out to me. And you get a designated study manager. As I said, that's how we started out. You'll get someone who gets to know your company inside and out, and how you need to make your claims, and they'll help you through that. So now I'd like to open up to a question time. So please feel free to ask any questions, and I'd be happy to answer.